All right, we're live.
All right, welcome back. We are continuing our work on bills to get out before our committee shuts down. Morning committees will shut down very soon. So Jen, thanks for coming back with us. We're working on two bills, 210 and 430. How much is in 430 that we need to look at that's new?
Not a ton. I sent it to you last night.
Yeah.
Um,
Committee, can we just go through that one and finalize it, I think, and then we'll really hash out a little bit more on H120 or S120, I forgot the number.
let me
Let's do
just,
430. Let's go through it.
okay, give me a second to pull that up.
I'm sorry, which one are we doing?
The Dr.
430.
Dinosaur 430.
Dr.
Dr. Dinosaur
like.
like?
We're
Yes.
going to call it the Raptor
Exactly.
bill. The Velociraptor. The something. Brontosaurus.
All right. So this is H430. It is an act relating to expanding eligibility for Dr. Dinosaur to all income eligible children and pregnant individuals, regardless of immigration status. At least that's its current title. And so we looked at language yesterday. I have highlighted in blue, and I sent you this last night, the changes that I made in collaboration with Diva. This is not the language. Sorry, Nellie. I don't think I
don't see the
sent it
blue.
to you. Nope, I didn't send Nellie this one.
All right. You
so
want to
let
go to
me-
120 while we get that sort of set up?
Um,
How long will it take?
Well, I can put the language up on, I can send it to
Yeah.
Nellie and then put the language up on the screen and we
Good.
can look at it while she's posting.
Good.
Sorry, Nellie. It should also be in your email.
Yep.
All right. Just sent that to her. And putting it up. Okay, now you have language in blue. So this is H430. Again, it's the Dr. Dinosaur like coverage. So what I've done here is add a new, I've made this new subchapter 2 sections, with the first one being legislative intent. And so this helps us really kind of make that connection to Dr. Dinosaur without raising the concerns Diva had about tracking the language in the program itself in a way that would require them to do a full Medicaid eligibility determination and denial first. So this has a new section, Dr. Dinosaur-like coverage, legislative intent. And it says, in establishing Dr. Dinosaur-like coverage for children and pregnant individuals who are not eligible for the Dr. Dinosaur program because of their immigration status, it is the intent of the General Assembly that the hospital, medical, dental, and prescription drug benefits and eligibility criteria for the coverage set forth in Section 2092 of this chapter should align to the greatest extent practicable with the benefits and eligibility criteria of the Dr. Dinosaur program. Then we get into that coverage piece. So now we have the Dr. Dinosaur-like coverage. And the coverage. So again, we still have this term, including migrant workers who are employed in seasonal occupations. And then we have AHS provide hospital, medical, dental, and prescription drug coverage equivalent to coverage in the Vermont Medicaid state plan. So that's what we have for this population in Dr. Dinosaur. To the following categories of Vermont residents who have an immigration status for which Medicaid is not available and who are otherwise uninsured. So we have children under 19 years of age whose household income does not exceed the income threshold for eligibility under the Vermont Medicaid state plan, and pregnant individuals whose household income does not exceed the income threshold for eligibility under the Medicaid state plan, for coverage during their pregnancy and for postpartum coverage equivalent to that available under the Vermont Medicaid state plan. So this language is really trying to address the concern that was raised in the House about what happens if the eligibility income levels change in the regular Dr. Dinosaur program, or there's an extension of the postpartum coverage for a year, which is an option that will be available to the state under the American Rescue Plan Act. So this ties the eligibility and that postpartum coverage and the benefits up here to what we have in the Vermont Medicaid state plan. So it's equivalent to, but it's not actually putting somebody on those programs. Does that make sense?
Yes.
Great. And then we have the language that we looked at in yesterday, which I've kept highlighted because the House committee has not officially seen it yet. So blue was what I added yesterday. Green was what you've already seen. That the confidentiality provision set forth in section 1902A of this chapter shall apply to all applications submitted and records created pursuant to this section, except that AHS shall not make any information about applicants or enrollees available to the US government. Then we have again, the agency can adopt rules to carry out the purposes. We have that 1.4 million in one-time funds with this language added here that the outreach and information would be culturally and linguistically appropriate. And then we have a new second sentence, the outreach and information shall include information on the confidentiality of records pertaining to applicants and enrollees. And I think that is it, other than the name change to an act relating to eligibility for Dr. Dinosaur-like coverage for all income eligible children and pregnant individuals, regardless of immigration status.
Jen, just a quick question. Will that new title be reflected in that first paragraph?
No, because this is what it is currently called. So it's after passage.
After passage, it will be.
Yes,
Okay.
it's right. Now it may have the title change when it goes back over to the House. I'm not always entirely clear on when the House Clerk and Senate Secretary make those changes, but this lead-in language refers to the bill that you received.
Got
and
it.
it does have that title.
Okay, committee, other questions? Okay, and Nellie, I guess it must be up on our webpage.
It does
So
say
we
it's posted.
refresh. There it is. So this is a strike all amendment to H430. Jen, I guess you can probably take it down unless someone has a question about specific language. Looks good. Okay. Excellent. Questions? Okay. Well, it looks like we could act on this bill, H430. This is a strike all amendment, H430, draft 2.2. Is that right, Jen?
I believe so.
I want to make sure I'm looking at the right number.
I know.
Yep, it's blue. And so it'll stay the same. It doesn't change when you take the highlighting out.
It does not need to. You haven't made any additional changes, so I will just
Okay.
remove the highlighting.
All right, good. All right, committee, I would entertain a motion.
I move passage of draft number 2.2 of H430.
Okay, discussion? Okay, hearing none. Senator Terenzini,
Thank you, Senator Lance.
this is why you get paid the big dollars.
This is that extra 1,000 I was told.
Yes,
about,
it
right?
is.
Yeah, that's right. Still waiting for that, by the way.
Me too.
I'll call the roll. Start with myself. I will be yes. I'll go with Senator Hooker, please.
Yes.
Senator Cummings.
Yes.
Senator Hardy.
Yes.
Senator Lyons.
Yes.
I get 5-0.
Okay, good. So I think I'd like to report this unless there's a strong desire for who hasn't. Senator Hooker hasn't done a major bill yet. I mean, it's up
I'm
to
happy
you. Huh? I can't hear you. You just muted
Well,
yourself.
unless Senator Hardy wants to do it, I don't know.
Well, it's either me or you, because
Okay.
I would like to do it, but I'm happy to have you do it because you haven't done, I don't think you did, the last one you did was S22.
Yep.
And
Do
now you're doing
46.
age 46.
Okay, I'm fine. That's
Okay.
good.
Right.
Thank you.
I will send you
This-
the clean
this
copy,
one-
Senator.
And I'll tell you why I wanted to do it. Thank you. Thanks for doing that, Jen. And thank you for your work on this bill. This has been an interesting exercise for us. We haven't had the opportunity to look at undocumented folks within the healthcare system. So this is great. And I'll tell you why I did want to do it and why I feel supportive of it. And again, I may stand up and say something. And that is of the work that I've done over time with undocumented workers and their families within the healthcare world. And so it's something important. Okay, so let's, in other languages, which makes it even more fun. All right, so let's go back to 120, please. And then Senator Hooker, this one will definitely be going to appropriations.
Hmm. Okay.
And I don't know, just FYI, I do not know what the discussion was. We had it on our list of bills up front. There was not money in the budget for this as it came from the House. So the Senate Committee on Appropriations may or may not include it, but it's in, and I would hope that the bill keeps its integrity going forward and doesn't get co-opted, but you never know. Just that's a heads up. And I know, here's what I'm thinking, committee, if there's any problems with this one going forward, this is something now that we have and we can introduce her again next year. Can we do that, Jen? Can we introduce this as a bill?
Potentially, I mean, yes,
Okay.
it's already introduced, but
I know,
I
okay,
mean, it already exists, but I think you
All
could
right.
do another one.
okay. All right, let's go for let's do the S-120. I haven't heard the direction that this bill is going to take. I have communicated with the pro tem about it, but we'll see. So S-120.
Okay, when we had stopped, we were looking at we just finished working on a new number 2 on the powers and duties.
Okay, so we're looking at the same one, or did you do any updates on to task force yet or anything like that?
Yes, I mean, I have a working document going. I can put
Okay.
that up if you want to look at it as we,
Yes,
Look
I
through
think
it. I've
that
changed
because our
that.
time is getting short.
okay. And then we will work on it together. All right, so here is what I changed to task force throughout, but I added at the end of powers and duties, the task force shall consider the following, keeping in mind the principles for healthcare reform enacted in Act 48 and codified at 18 VSA section 9371.
Great.
Does that work for folks?
That looks good. Thanks, Jen.
Great, sure. All right, and then we have this new number 2, how Vermont's current healthcare system is impacting Vermont residents and businesses and their access to affordable healthcare.
That is so good.
Clean.
Thank you, Senator Cummings. And Jen. Okay,
Great. All right. And then
Okay, oh, I see something that I keep forgetting to bring up, and it is, there are two things that have been bugging me a little bit. One is I don't know how the task force gets together by July 1st. That's probably an impossibility, given that there may not even be
that is-
identified. So, and then the other one is the number of meetings. Eight meetings beginning in September is, I don't know how that happens. So I'm raising this as a very practical concern. So on the beginning on or before September 15th, and then, I don't know, 2 or 3 months for 8 meetings. And I actually dreamt about this one last night because it was, I could see the the pressure to complete 8 meetings in that period of time, and knowing what any support people are going to have to do to make it happen. So I think there needs to be a different number in there. Let's start with that one.
I agree, Ginny. Senator
Uh,
Lyons, I think
Can we
8
do
is
up
too many.
to,
How about, what did you say, Ann?
do up to 8,
Let's make it
up
up.
to 8 meetings, covering all areas of the state.
Well, why don't we say up to 6? I mean, up to 8, if then you feel compelled. I'm just worried about the pressure that whoever is guiding this group along is going to feel about visiting every single county and having 8 meetings. It's not up to 8, Anne. I mean, think about
I
how
don't care, up to something,
up to something. We're all up to something. So
rather than a set amount. If, you get an early snowstorm or,
why
I
don't
mean-
we say a sufficient number of meetings not to exceed?
and probes
Nah.
won't like that.
I know, I don't either. I don't like that either.
They gotta budget it.
And it says that it can be in person or remote. I mean,
It does, but nevertheless, there's notice that has to be given out, and the people who are keeping notes have to keep notes in between. If it's the Office of Legislative Operations, these people are going to be working overtime. I mean, really hard. Not easy to do what's done. Communicating with people about Zoom. Having a public hearing on Zoom is not simple.
So I think that one of the things to think about is you have the first meeting of the task force happening by July. You have them considering a lot of things other than, the number 2, I think, is really the kind of the hearing from the public part, and maybe
Yeah.
some of these other pieces. But how you see these, if there's going to be, I don't know if you're going to set a total number of meetings, but how you see the non-public hearing part of this group's work
Aha.
rolling out, and how what their end product is supposed to be, and how that relates to what they're doing in these other powers and duties and the
Okay.
public hearings.
I'm hearing what you're saying. I think the suggestion then would be, I still think July 1st is way too early. I mean, could be August 15th. And the meeting that the task force shall have an organizational meeting no later than organizational meetings no later than August 15th. That gives folks an opportunity to get together and talk about what's coming next and doing some of that planning. And then the September 15th date would be the date by which the task force would have public hearings up to, and then say up to 6. It's possible that the task force may want to meet 2 times before, and then the public hearings would be up to 6. So that's 8 meetings included, so a total of 8.
Actually, below, under compensation and reimbursement, it does say for not more than 12 meetings.
Yes, good point.
So you might want to, sorry, go ahead, Jen.
No, I said that's a good point.
Not more than, I don't know how any task force in this time frame is going to meet 12 times unless there's a couple meetings in there that last an hour.
You could be silent on a number of public meetings and just say compensation shall be given up to X meetings. And then let them decide how many public meetings they want to have and how many non-public meetings they want to have.
How does the committee feel about that suggestion?
I mean, they're all public,
They're all public.
public hearing.
Right, it's the difference between the hearing, whether
Right.
it's to hear from the public or whether it's to
Right.
discuss in public.
Yeah,
I think that sounds good. So and I agree with Senator Lyons that July 1st is too early. I'm okay with August 15th. And then the beginning on or before September 5th shall hold public hearings, right? Just be
15th.
silent on
Mm.
that.
15th.
Okay.
I think.
I just
September-
wonder if August 15th is getting a little late, if you haven't formed the task force yet. Maybe August 1st, make it a month rather than a month and a half. Between the time you're ordering and the time you have the first
Having
public hearing.
done some of this before, I think August 15th is really the time frame within which people are ready to get back and do things. And
Wow.
then there's a whole month between August 15th and September 15th. The
For the
task force could meet
Great.
2 or 3 times, I think probably meet a couple of times.
If you have the honor before, it doesn't have to be as late as whatever date you put.
Yeah, you're right.
So
You're
You
right.
could say, so if you said August 15th and people wanted to
Yeah.
meet July 1st, that's
Yeah.
still honor before
Yeah.
August 15th.
Yeah, that's good. That's good.
So are you wanting so do you want August 15th
15th.
in here?
On or before, right. That's the last date that it should happen.
Mhm.
Right.
Yeah, okay.
Flag that as a change. And then your public hearings,
Then I think Nolan's comment about being silent on numbers, but having a number of meetings for the task force overall,
Mhm.
that gives some latitude.
so a couple of questions here. Do you want a beginning on or before a certain date? Does it matter when they decide to hold their, do you want to not, this is sort of a,
Yeah.
well, I
that's-
guess it's beginning on or before, but yeah, you don't necessarily need to specify a start date for that if you don't want.
Committee, what do you think about that? I'm fine with the on or before. It kind of gives some structure.
But flexibility.
Yeah.
Either one. I don't have strong feelings.
Okay, then leave that.
Okay, but you want to take out the number?
Yes.
Do you want to keep the,
And then instead of saying each in different Vermont counties, I don't know.
I think it
More
gets difficult if
meetings.
you're thinking a lot of it's going to be remote because
I know.
it's sort of, held in the virtual world.
For each-
What about saying something like to hear from Vermonters from people across the state? That's how I'm trying to figure out how to make it more about hearing from people rather than the county.
How about hold public hearings in various regions of the
Regions of
state?
Yeah, that's
Well,
what
what about to hear from people in various regions of the state, because it's also Zoom. Remember that. It could be Zoom.
You could also, again, be silent on that. And if it's going to be Zoom, then maybe the committee may decide rather than regional, each meeting has a specific focus, maybe on access, maybe on costs, maybe on, you know what I mean? So maybe if you don't dictate, you can let the committee decide how you want to break it up.
Well, if it's in different regions of the state, the committee can also decide to hear about different aspects of different parts of the charge. You're right. So I'm agreeing
I'm
with
just
you.
saying.
So
yeah,
if you're
let the
wanting
committee-
it to reflect people from different, I put in here, hold public hearings to hear from Vermont residents from different regions of the state that, or you could say from all across the state or from around the state. Maybe around the state is better.
I like around the state.
So if you're just hearing from them from around the state, it doesn't specify where it has to be
Right.
held.
Yes. It's hard to specify where it's going to be held, and because it brings up a couple of problems. One, if it's Zoom, it's Zoom. You can't just, you're not going to travel to Montpelier to Zoom if you're not there. But the other issue is, if these are being held, then where are they being held? So there's some logistical work to find a town meeting, a meeting place, a town hall or a school or something to hold meetings. That requires some work. Okay. Well, so committee, look at the language that Jen has just put up there.
Right. So it just says hold public hearings to hear from Vermont residents from around the state. I don't know if you want to keep this to gather information from state. I mean, I think you may not need that gray highlighted piece.
Yeah, we don't really need it.
Is that
We just want, we do,
work to
yeah,
take that out?
yeah.
Yeah, let's just keep
I
it
would say
simple.
so.
I'm in the let's keep it simple. Like the Anne, you should just come up with all the language. Just keep it simple.
All right. Do you want to keep public hearings
I'm
maybe held in
simple.
person or by remote means?
Yes,
Sounded like you did.
Important.
yeah.
Yeah.
Do you want each public hearing to begin with a panel discussion involving task force members and local stakeholders selected by the task force?
I think that's a decision the task force can make. That
Absolutely.
may be
Yeah.
that they don't want to start that way.
Right.
And,
Yeah.
they might do it that way once and then find out that it's not helpful, so let's
So,
let's
you
go
wanna-
to the Cummings
okay.
advice.
Do you want a summary of the findings from field hearings included as an appendix to the report?
I do.
That I think would be
That's
helpful.
important.
Just-
Yeah,
Yeah.
and
Gina,
the summary could also be a recording. That's the other thing. Well,
That's not a
Okay.
summary. I mean,
that's
I
not
would,
a summary.
that's a verbatim,
That's a bit,
non-written.
yep,
I
so
think
let's
some
keep
sort of
it as a,
summary, even if it's just a paragraph that says that the, Addison County thing, we heard this, and this kind of summary. It doesn't, we don't have to specify how it's summarized, but I think a summary of what is learned at these is important to include in some
Good.
form.
done.
Then we have the assistants. So hire a consultant to coordinate the task force's work. And then also the administrative, technical, and legal assistance from the Office of Legislative Operations, the Office of Legislative Counsel, and the Joint Fiscal Office.
Yep.
And there's the findings and recommendations due by January 15th on the most cost-effective ways to expand access to affordable health care for Vermonters without health insurance and those facing high healthcare costs, and the various options available to implement the recommendations. Is that what you want them to come back with?
Sure. I don't see why not.
That's fine. I'm just
Yeah.
asking if this
Does
still
anybody
reflects,
want them not to come back with something like this?
well, or something different. Is there something different?
I'm not hearing anything, so.
Okay.
that's good.
So the first meeting would occur now on or before August 15th. And the task force would select House and Senate co-chairs from among its members at its first meeting, and they'd alternate acting as chair at meetings. A majority of the membership constitutes a quorum, and it ceases to exist on January 15th.
Very good.
All right, we have per diem compensation and reimbursement of expenses for not more than how many meetings?
8. What do you think? I just know what the time factor is
Fine.
here. What do you think? Senator Cummings?
8 is good.
It's good, whatever Probst will give us.
Okay, go for it.
Well, it's built into the 175,000 appropriation.
It's already in 175.
So that would change.
Oh,
Well, no, I don't think it has to.
No, yeah.
What did the House have if that's what they
Oh.
put in?
this
And this
is,
should be,
this is
this is yours.
Senator. There's no House bill. This is, and
All right.
Nolan, we need to
That's right. It was
appropriate it
the other one.
to legislative operations here as well, not to the joint fiscal office.
Yeah,
I think 8 is fine.
I agree.
It's good.
and just so you know, it'll be about, if everybody went to every meeting, and it would be about $10,000. I think that can be captured within the 175 pretty easily.
Okay.
Okay. So that's the end of your
Right.
task force language.
Okay.
And then we get into the ACO. Oh, I can take this part out. We get into the ACO data collection and analysis piece.
Okay.
Anything with that? Okay. Then we have the PBM 340B language.
Yeah, so we got in YouTube request world a couple emails, but one went to just Senator Lyons and me, and
Oh, I
one,
haven't seen it yet. What is it?
yeah, no, that's okay. And one went to just me from Helen Laban and Devin Green, and they both say more or less the same thing. So I can summarize for you. That this is really about prescription, the pharmacies making the administrative costs more difficult for hospitals and clinics to participate in 340B, and then some prescription drug manufacturers refusing to provide any kind of discount under the program, and they name a specific pharmacy oversight that's doing it, which I won't talk about, but and so this is to avoid private pharmacy benefits managers from putting administrative burdens on the hospitals and the clinics who participate, because it makes it harder for them to participate in the 340B program. So that's the sort of answer to the question I asked, which is, what is the problem we're trying to solve? And I can read the whole thing if you want, but that's kind of the basics.
Are we okay with that? It's really about PBMs.
We love them.
Senator Cummings, we can't hear you.
No, just an aside comment.
Okay, all right.
My feelings for PBMs.
Okay, we're good. All right, so
Good, you couldn't hear me.
I can
Okay, so-
imagine.
So you're good with this language? We're
Yeah.
set on this section?
Yeah.
Okay. And we have the state health improvement plan with, again, putting
Okay.
in the commissioner.
Yeah,
And then the next section has that, the commissioner submitting copies and any updates and the timeline for adoption of a new state health improvement plan. I will note that the current state health improvement plan covers 2019 to 2023. So I'm not sure, I mean, I think they have made updates, and I would expect that probably this next one would be to start for 2024.
right.
I just have it open. All right, and then we have, and I did take out that section on the auditor access, so, and I've renumbered the sections. So
Okay,
if you were looking for things based on old numbers, that's why. Then we have the Green Mountain Care Board report on the health insurance administrative expense and how those increases have lined up with the consumer price index increases over the last 5 years. Then the ACO care coordination report. And then the various primary care visit reports and the impacts of the individual and small group market and the large group market of implementing provisions like that.
I'm thinking that study might inform some of the reporting that the task force does. I mean, so there might be some benefit to having this study in place. That's all.
Sure, and that, I mean, the task force could certainly ask for
Yeah.
updates from these folks
Yeah.
as they're doing the work.
Yeah.
If they have any conclusions to share. And then we have the effective date, and so I'd left this highlighted in here in case you made changes to it, but if you're keeping that PBM language, then this would be an effective date, so it would take effect on January 1st and apply to contracts entered into or renewed after that. You could probably have it take effect on, July 1st of this year and apply to all contracts, as long as it's prospective,
Okay,
not making
Yeah.
changes to existing
I
contracts.
think that makes sense.
Not sure there's a particular reason other than Utah's was a January 1st, so I lined it
Yeah.
up, but I don't think that needs to be that way. Since it's all forward looking.
Okay. All right.
That out. And then we just need a new title.
Okay. This is a quiz. Is this a task force on the access and affordability to healthcare or what?
And other miscellaneous subjects.
Yes.
But you want a miscellaneous healthcare subjects?
No, we do
I
want
think
to
we want the
type,
task force.
huh?
I think we want the task force. That's
Yes.
Relating
part of
to
that
the-
purpose is to let people know we are still working on healthcare.
Right.
On
No,
the
I can't remember what
accessibility
we
and
called it. I have to go back
affordability.
up to the top. Task force on affordable, accessible healthcare. Task force on affordable, accessible healthcare. Is it just that, or do you want other healthcare provisions or something?
And related healthcare provisions. Not?
I don't know if it's really, if they're
They're not
related, but
And other healthcare.
other
provisions.
healthcare provisions. Great. Put this on the next page.
Oh, good.
All right.
Okay. So, committee thank you, Jen. This looks really, we've made some long steps. I was going to say strides, but big steps. Committee, the question that Senator Hooker raised earlier was, is this a committee bill or is it a S1? Want to keep it as S120? You want to move it to committee bill? I don't know what the distinction will be when we pass it out. I know that Senate Finance had luck with their
bill.
committee bill.
Has S120 already been through rules or not until you voted out?
Not until we vote it out. Once
So
we
that
vote
was
the
the
bill,
same either way.
huh? It's the same either way. So
I don't think it matters. And S120 has the other senators on it, so they may want to stay on the bill.
well, I'm not on the bill,
Right. I
and
mean,
neither is Senator Terenzini. So the question is, do you want us to be on the bill? I'm agnostic, actually. So if you guys want to take it forward, that's fine.
I don't care. I think whatever's easier, if it's easier to have it as a committee bill, then let's do that.
I'm fine with a committee bill.
Senator Terenzini, do you want to be have this be as a committee bill? Are you okay with it that way?
I'm fine either way, Senator Lyons. I'm going to support the bill. So if my name's on it or not, it doesn't matter to me. However,
You
we
know,
decide.
as a committee bill, it's a committee bill, so there are no names on it, and it does make it a little bit more, I would say, compelling to take it up when it's a committee bill.
Whatever you feel, I'm fine with. Committee sounds great.
Sure.
Okay, let's do it. Jen, can we just do that? Okay.
I'll need to get it processed as a committee bill. I have to get a request number and all that, but I need to have it edited anyway. So
Okay.
yeah, so yes, it's easy enough for me. It's just going to be a copy and paste.
All right.
I just have to write do the summary, the statement of purpose part based on what's in it.
That'll
Well,
be
it has to-
simple.
I'm sorry. Will it have to go through onto the floor and then back to us and then back to the floor kind of thing?
No, it won't. It just won't get introduced until we've done all of that
I see.
part of it.
Okay. Can we
It'll
on
go
it
right
now
to
or not?
rules. It will, I think it will go right to rules
true.
and then,
And then it will go to appropriations
and then it will
anyway.
go to appropriations. And theoretically, the 175 will already be in the big bill. So since it is a one-time thing, it's not general fund
ARPA fund.
dollars, it might actually be a good thing. Okay. All right, Jen, so this then is the committee bill with the title that you just put in.
Yes.
Anything else we need to do on this bill? I think I've remembered all oh, I do have one other thing. So we sent our letter with hearing aid language on the DFR, and I think, Nolan, do you know if that made it into the budget? The hearing aid, or Jen, do you know if our hearing aid DFR language for benchmark plans made it into the budget?
I don't know.
I don't know either.
Is there any value in putting that language into this bill? I mean, suppose it's not included in the budget and we keep hearing about how important hearing aids are, and please pass the language that's in S-132. No question that if something doesn't happen, we're going to see that bill in our committee again, or in Senator Cummings' committee on hearing aids. So the question is, do we want to, Jen, how is it, can we just add the language in this bill?
Sure.
And then the question is, should we do that? We can, so should we?
And so really what you'd be doing is making sure that the legislative priorities for what gets looked at, including hearing aids and those other items, is part of the benchmark plan review, and then having the report come back to you. So that would be the rationale.
Yes.
That's fine.
And it's kind of belts and suspenders. Of course, when the bill goes to appropriations, they can take the belt away or the suspenders away, but
Sure, I can certainly add
It's
that.
fine with me. It would include the whole list though, right, Jen? The same language we
I'm,
have.
I'm, yes, I am. I just
Mhm.
copied it out of the memo and I'm gonna paste it into here. So that's
Sounds good.
exactly what you've seen before.
okay, that's good. That one's been bothering me a little bit because I just think it's so important to people. I guarantee we're going to hear about hearing aids going forward,
Mhm.
and the task force is going to hear about
Mhm.
hearing aids going forward. It's one of the things the federal government could do, just really.
Do a lot.
All right.
Okay, I will be putting it in as a new section 10 and making section 10 section 11. Okay, so I will turn this into a committee bill and have it edited and send it around to all of you. I should be able to send that around to you hopefully later today, if that works.
So the question is, do you want to vote on the bill pending our review when Jen sends it around? We can do that. We have done that in the past. And then if there's a concern about the bill, we can probably get back together. I think the budget's not going out till Tuesday. Is that right, Nolan? Do you know?
Thought it was today.
I did.
We're
too,
voting
but-
it today, but I think the work is happening to sort of put it
through
all
to-
together over the weekend.
Yeah.
Yeah.
Okay, so let's do it. I think we probably should vote on it then. And then ooh. Then it goes to rules. Okay. I'll have to deal with where it goes to and how it's handled and check in with the pro tem about that. So so shall we vote then? I'm not seeing anyone say no, don't vote. And then Jen, when you send this around to us, if there's a big glitch, we can come back. We've done that before, I think. Okay,
Mhm,
committee?
mhm.
Oh, yes.
So do you need a motion to
Uh-huh.
take
I
the
need a
vote?
motion to pass the committee bill entitled, and I leave it to
Okay.
you to remember the title.
Um, the task force on affordable and accessible health care and other health care
Related.
related.
No,
other-
just
no,
healthcare.
no,
And
related.
other-
You're right.
And other healthcare topics,
Provisions.
provisions.
We
Okay.
can, whatever you,
Whatever the legalese is.
Good work.
Okay.
Okay, is that a motion?
Yes.
Discussion?
It was.
Ooh, okay, thank you all. This has been a real this has actually been kind of good, I think, for us to do this. It's been great. And I think that the task force is an excellent idea. And going out and hearing people is
Here we go.
going to be terrific.
Let's hope it gets all the way through the process.
Yeah.
Okay.
So
Do we need a vote?
any other Senator Terenzini?
One more time.
Okay, at this time I'll call the roll. Myself, yes. Senator Hooker,
Yes.
Senator Cummings,
Yes.
Senator Hardy,
Yes.
Senator Lyons.
Yes.
500. Thanks.
All right, so that's good. And I know that, who would like to report this?
Senator Hooker.
I didn't hear you, Senator.
I think Senator Hooker should, or Senator Hardy should report this one.
Yeah, I do too. So Senator Hooker, why don't you report it? And you're also reporting 430.
And H46.
I'll take H46 off your hands
Okay.
and I'll let you do both of those.
right.
Unless, and we'll, that's good.
Okay. Thank you.
So H46, can you send me what Katie sent you?
Yeah, she
The
sent a
final
clean
iterations?
copy. Yeah.
Okay. Nellie, so we're good on all these things. Everybody has really pitched in and worked hard. And Senator Hardy, you've worked super hard on some of these bills and
Most.
really appreciate that.
My pleasure.
Yeah,
I'm so
It-
proud of us for voting out all of these bills today. It's really amazing. Thank you, Jen, for all of your work.
it's good. So
My pleasure.
I'm looking, hang on a second. Okay, so here's Nellie. I have a request for Nellie for each one of us. I'll send Nellie a list of the bills that you are each reporting and that I'm reporting, and ask her to get you a witness list for the bills.
Okay.
Okay,
Mhm.
and then you should be receiving a clean copy from Jen or Katie. And Nolan, if you have, I know you have, can get the fiscal notes off on these. Maybe just send them to Nellie and have her post them, and then we can each pick up the ones that relate to the bills that we're reporting.
Yeah, I'll have them all done by Monday.
Perfect. We have met our principal criterion of finishing early. Jen and Nolan, thank you. You have both been extremely helpful in our deliberations. Really very much appreciate your work. We are so lucky. So lucky.
thank you.
So,
Sure.
committee, we finished early. It's been a pleasure. So next week we do have some more work, and we're going to have some things on our agenda to look at on Thursday. Next, we are meeting jointly with Judiciary. I think you saw the note yesterday. Both Senator Sears and I asked to have Commissioner Levine's testimony from the House. That it's actually when they first took up the issue of buprenorphine, and it's really it's almost a legalization, but you should look at H225. Did I send that around to you yet? No. Okay, I'll send that to you. We're going to look at 225 with judiciary. The bill will be in judiciary, but it does have, there are implications around clinical medical treatment, addiction in particular, and the role that buprenorphine may or may not play in addiction. But again, holding people, making it illegal for younger people to hold a certain amount of buprenorphine. So we will look at that. We'll have testimony from the medical side and the counseling side and judicial side. And it will be really a focus on the judicial questions, the legal questions, but it's important for us to be there and then to weigh in on whatever happens to that bill. Go ahead.
Madam Chair, did the bill get through rules?
I'm not sure whether it's through
Okay.
rules yet or not.
Not
But
yet.
it's still there, but if and when
Okay.
it comes out, it will be in judiciary.
Okay, and we are hearing testimony from various groups. It's.
Yes.
Yeah,
Yes.
okay.
Yeah, that's the whole point of our our joint meeting next week, is to hear some testimony. The bill has come over late, but there are a lot of people who believe that this will help with the perception around addiction as a medical issue. And so we'll hear that perspective. Okay. And then we have appointments. So we'll do that next week too. Okay.
Thank
That's
you.
good. I'll see you
Thanks,
next week.
everybody.